Have you been feeling more tired than usual, experiencing blurry vision or an unquenchable thirst? These symptoms may seem harmless, or you might think they're just part of getting older, but the reality could be much more serious. If you are over 50, these could be early signs of diabetes, a disease that progresses silently and, if not detected in time, can lead to severe complications such as heart disease, vision loss, and even amputations. In this video, I will not only show you how to identify the early signs of diabetes in people over 50, but I will also provide practical recommendations for managing, and in many cases, preventing this disease. As we age, the risk of developing type 2 diabetes increases for several reasons. Metabolism slows down, which can lead to weight gain, a significant risk factor for diabetes. Additionally, as we get older, the body can become less sensitive to insulin, which means the pancreas has to work harder to produce the necessary amount. Genetics also play an important role. If you have a family history of diabetes, your risk is higher. Now let's dive into the warning signs you shouldn't ignore. Number 1. Increased thirst and urination. One of the most common and early signs of type 2 diabetes is a noticeable increase in thirst, accompanied by a constant need to urinate. This symptom, medically known as polydipsia, may seem harmless at first, but it is one of the earliest warnings that something isn't right in your body. When you have diabetes, blood glucose levels rise because your body cannot properly use insulin or doesn't produce enough of this hormone. As a result, excess glucose builds up in your blood, and your kidneys work overtime to try to filter it out and eliminate it through urine. This process causes your body to lose more water, making you feel thirsty almost all the time. A study published in the journal Diabetes Care found that 70% of patients newly diagnosed with type 2 diabetes reported a significant increase in thirst and urinary frequency before their diagnosis. This finding highlights the importance of these symptoms as early warning signs. You might find yourself drinking glass after glass of water, yet the thirst doesn't go away. Additionally, you may notice that you wake up several times during the night to go to the bathroom. This frequent urination disrupts your sleep and can lead to a feeling of exhaustion during the day. If you are experiencing these symptoms, it's crucial to pay attention. Don't dismiss them as just a consequence of drinking more fluids or aging. They could be an early indicator of diabetes, and the sooner it is diagnosed, the better your prognosis will be. Number 2, constant fatigue. Another key symptom that many people with type 2 diabetes experience, but often attribute to a busy life or aging, is fatigue. This fatigue is different from simply being tired after a long day. It's a feeling of exhaustion that doesn't go away with rest. Constant tiredness occurs because, in people with diabetes, the body cannot efficiently convert glucose into energy. Insulin is the key that allows glucose to enter cells to be used as energy. But when insulin isn't working properly, that glucose remains in the blood, leaving your cells hungry for energy. A study published in the Journal of Clinical Endocrinology and Metabolism reveals that over 60% of patients with type 2 diabetes report chronic fatigue before being diagnosed. This fatigue is a sign that the body's cells are being deprived of the energy they need to function properly. Number 3, blurry vision. Blurry vision is a symptom that can develop in the early stages of diabetes and is often ignored or attributed to aging. However, this change in your vision is a clear indicator that your blood glucose levels are out of control. When blood glucose levels are too high, they can alter the shape and thickness of the eye's lens, making it harder to focus and consequently causing your vision to become blurry. This effect can come and go depending on how much your blood sugar levels fluctuate. A study conducted by the American Diabetes Association found that blurry vision is one of the first symptoms reported by over 30% of patients at the time of type 2 diabetes diagnosis. These changes in vision can be an early sign that diabetes is beginning to affect your eye health. Many people notice that they need to change their prescription glasses more frequently, or that their vision seems to change throughout the day. While it's easy to assume that these changes are just part of natural aging, in reality they could be one of the first signs of diabetes. Number 4, slow healing wounds. One of the most concerning signs of diabetes is the difficulty in healing wounds. This symptom is particularly alarming because it indicates that high blood glucose levels have started to damage blood vessels and nerves. Normally, when you cut or scrape yourself, the body initiates a complex process to heal the wound. However, in people with diabetes, this process is hindered. Excess glucose can harden and narrow blood vessels, reducing blood flow to the injured areas. This means that the nutrients and oxygen needed for healing do not reach the wound effectively. Research published in the New England Journal of Medicine shows that people with type 2 diabetes are up to 3 times more likely to develop serious wound infections than those without the disease. This study underscores the importance of monitoring the healing of any wound, especially on the feet, where diabetic ulcers can lead to severe complications if not treated promptly. Additionally, elevated glucose can affect white blood cells, the cells responsible for fighting infections, increasing the risk that a small wound could become a serious infection. This problem is particularly dangerous in the feet, where diabetic ulcers can develop, and if not treated in time, lead to severe complications, including amputations. Number 5. Tingling in the hands and feet. Tingling or numbness in the extremities, especially in the hands and feet, is a common early symptom of diabetic neuropathy, a complication of diabetes that affects the nerves. This symptom may start as a mild tingling sensation, but over time it can progress to severe pain or loss of sensation. Diabetic neuropathy occurs when high blood glucose levels damage nerve fibers, especially in the extremities. This damage can be irreversible if not treated in time and can lead to a total loss of sensation, making it difficult for people to feel injuries on their feet, which increases the risk of serious infections. According to a study published in JAMA Internal Medicine, approximately 50% of people with type 2 diabetes develop some degree of peripheral neuropathy. This study highlights the importance of detecting tingling and numbness as warning signs of potential neurological complications. At first, you might only notice a slight tingling or numbness in your toes or hands, which may come and go. However, this symptom is a clear sign that something is wrong in your body and that the nerves are starting to suffer damage. Now that you know the early signs, it's the perfect time to learn how to effectively control it while you sleep. In this video, we reveal 5 nighttime habits that can help regulate your blood sugar levels while you rest.